Confirmed cases in the DRC have now topped 450, and the doctors closest to those cases are working without protective gear.
This is Ebola Watch, and today, the story lands somewhere American listeners can feel it: the World Cup.
We've got the new official count out of Kinshasa, EU emergency aid in motion, and a US warning to Europe over screening. Daniel, let's start with the number.
452 confirmed. Walk me through it. Is that real news spread, or is the lab just catching up?
That's the right question. The Ministère de la Santé puts it at 452 confirmed as of June 4th, up from the 378 baseline the CDC's MMWR gave us as of June 2. 74 cases in 2 days. Before we call that acceleration, I want to know how much is lab confirmation of cases that were already suspected versus genuinely new transmission. The shape of the curve depends on that.
And the fatality rate moved too. I clocked 15.9% last week. What's it now?
18.1%. 82 deaths against 452 confirmed. That's a meaningful climb, and it's the official figure, not a projection.
Okay, here's what gets me. 2 episodes ago, I asked whether the infection prevention support was actually reaching health workers. KFF just answered it. Doctors in Ituri have little protection, no tests, supply chains cut by travel bans and conflict.
And that lands right on top of the casualty figures we flagged. 34 health workers infected, 7 dead. The June question was whether you could restock the staffing math. KFF says the protection was never there to begin with.
So you've got a $518 million plan announced, EU aid dispatched June 7, and a doctor in Bunia still can't get a glove and a test kit.
That's the gap we've been circling all week. The resources are moving on paper. KFF documents that they haven't arrived at the bedside. Both things are true at once.
Now, the part that hits home. The Trump administration is warning Europe to mirror US travel restrictions ahead of the World Cup. Kara, what does mirror our restrictions actually mean for someone holding a ticket?
That's where it gets pointed. Screening standards here are being shaped by event logistics, a tournament on American soil, as much as by any epidemiological risk threshold. Those push policy in different directions, and right now the calendar seems to be steering.
And it's the same week the EU sends emergency aid to the DRC. So Europe's getting pressed to wall things off and asked to help at the source. Those two postures don't obviously fit together.
They don't. And now there's a third point on the diplomatic map. Washington pressing European capitals directly, outside the WHO-led frame, outside the Kinshasa-Kampala channel.
So the honest answer to, am I at risk at the World Cup? Your risk depends less on the virus and more on which screening protocol your host country actually adopts.
That's fair. And protection that actually reaches a nurse in Butembo does more for the man with the World Cup ticket than any airport line in Europe. That's the order of operations the aid story keeps reminding us of. Robert Herriman, writing in Outbreak News Today.
In a follow-up on the Ebola outbreak, the Ministère de la Santé RDC reports as of June 4, 2026, cumulative totals show 452 confirmed Ebola virus disease, EVD cases, with 82 deaths, 18.1% fatality rate, in 25 health zones in the provinces of Ituri, North Kivu, and South Kivu.
The Ministère de la Santé in Kinshasa now reports 452 confirmed cases as of June 4th, 82 deaths, an 18.1% fatality rate. That supersedes the 378 the MMWR had us anchored to as of June 2nd.
Wait, 378 to 452 in 2 days. That's 70-some cases. Daniel Brain says, is the curve accelerating?
Before we call it acceleration, 71 of those landed in a single 24-hour window, and we've watched suspected cases get reclassified into confirmed all week. So part of this could be lab catching up, part could be genuine new transmission. To read the curve, you have to hold both.
And the fatality rate moved too. I flagged 15.9% a couple days back. Now it's 18.1%. That's a real move, and the picture is getting worse.
It is. And geography tells you why it's hard to stop. Ituri is 94% of cases, and the hot spots are Bunia and the mining towns, Mongbualu, Ruwampara. Per Outbreak News today, those are exactly the high-mobility transport and mining hubs that move people, and people move the virus.
So a commercial transport hub as the epicenter. That's the worst possible address for an outbreak.
Here's European Commission.
On 17 May 2026, the World Health Organization, WHO, determined that the Ebola virus disease outbreak caused by Bundibugyo virus in the Democratic Republic of the Congo, DRC, constitutes a public health emergency of international concern, THEIC. This means that the outbreak poses a serious, unusual, cross-border risk that requires coordinated international action.
The European Commission page puts a number on the EU's own risk read. ECDC calls the infection risk for people in the EU EEA very low. The reason is pretty specific. Transmission needs direct contact with a symptomatic patient's body fluids.
Okay, but Sarah, the same page says this is Bundibugyo virus, and they flat out call it harder to control than the Zaire strain. So which is it? Very low risk or harder to control?
Both, because they're answering different questions. Harder to control describes the fight in Ituri. Very low risk is about whether it reaches a flat in Brussels. Two distinct things.
And here's the line that should stop people cold. No licensed vaccines, no specific treatments for Bundibugyo. We talk about vaccine equity, but for this strain, there's no dose to be inequitable about yet.
Correct. The countermeasure cupboard is bare. So when ECDC says low importation risk, that's the only firewall Europe's leaning on. Geography and biology, not a shot. Here's NBC News.
Washington. The Trump administration is urging European countries to mirror U.S. travel restrictions implemented in response to Ebola, as the U.S. prepares to host the largest ever World Cup, amid growing concerns about the spread of the disease, according to a State Department cable reviewed by NBC News.
Okay, this one's different. The Trump administration sent a State Department cable Monday telling European countries to mirror U.S. Ebola travel restrictions ahead of the World Cup the U.S. is hosting. And the cable reportedly warns that not adopting these precautions may have consequences. Kara, that reads like a threat with a screening policy attached. Public health is suddenly carrying diplomatic muscle.
Watch the sequencing. The screening standard here is being set against an event calendar, the largest World Cup ever on U.S. soil, rather than a clear epidemiological risk threshold. Those can point in very different directions. And the State Department declined to say what consequences means. So we have a confirmed cable, explicit pressure, and a deliberately blank space where the actual measure should be.
So practically, if I've got a ticket to a host city, what does mirror U.S. restrictions even mean for me? Right now, nobody can tell me, and that's the part that should bother people.
Here's Amy Maxman at KFF Health News.
They had cared for patients with similar symptoms in early May, before the outbreak was detected. One of the patients is now dead, Faraha said, and none of them has been tested for Ebola, even though samples were taken. The hospital still lacks access to tests and an adequate supply of protective gowns and plastic masks to keep doctors and nurses safe.
Two clinicians at the Karibuni Wamama Center in Ituri, a 25-year-old midwife and a doctor in his early 30s, sick with Ebola symptoms. Their medical director, Elizabeth Faraha, says samples were taken and never tested. The hospital still has no tests.
Samples taken, no tests run. So you've got people who treated a patient who later died, and they still don't know what they're sick with.
And the blockage is logistical, not medical. KFF documents that travel bans and the conflict in the East have broken the supply chains. So the gowns, the gloves, the tests don't reach Ituri even as the case count tops 450.
Kara, 2 episodes back, I asked whether infection prevention support was actually reaching workers on the ground. This is the answer in print. It's worse than I feared.
It is the report card, yeah. And remember the fatality numbers we read off the official tally? 18.1%. The people doing the containing are inside that statistic, working without protection. From Citizen Digital.
The EU said Sunday it has flown in 100 tons of humanitarian aid, including medicine, tents, and protective gear, to a hard-to-reach area in Eastern Democratic Republic of Congo struggling with an Ebola outbreak.
100 tons of aid, medicine, tents, protective gear, flown straight into Bunia. Kara, that's a direct hit on the supply problem we just walked through.
It's the air bridge that matters here. The Commission set it up with UNICEF specifically because Ituri's roads are impassable and armed groups make the ground insecure. They flew over the broken supply chain rather than trying to fix it.
And the EU Crisis Commissioner, Labib, showed up in person Sunday. Boots on the tarmac make it harder to treat this as just another press release.
Which is the part to hold on to. 100 tons landing in Bunia is real. Whether the protective gear inside those crates actually reaches a doctor in a clinic outside the city, through the same insecurity that grounded the trucks, is still unresolved. The plane lands. The last mile is still the hard part. And remember what's behind the urgency. There's no approved vaccine and no specific treatment for the Bundibugyo strain driving this, per Citizen Digital. When you can't vaccinate your way out, tents and gloves become the defense.
If Ebola Watch is part of your daily risk scan, try Iran War Daily, a daily foreign affairs briefing on the U.S.-Israel-Iran war, from strikes to ceasefire talks, Hormuz, oil markets, and Hezbollah spillover. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes. If something caught your attention, they're there for a closer read. That's Ebola Watch for today. This is a Lantern podcast.